Okay, so I'm going to go ahead and get started. So first off, my name is Kathleen Steele, and I'm a licensed mental health therapist. I will be moderating this session. I would like to welcome you all to the functional webinar series. Give me one moment. Perfect. Awesome. So welcome. As you see, today's topic is leaky gut intestinal permeability, the root cause of chronic diseases. So I'd like to start off with a quote from Mother Teresa. I alone cannot change the world, but I can cast a stone across the water to create many ripples. The purpose of these functional webinars is to create awareness about health among our patients and communities. We are grateful that you are part of this journey, and together we can help our friends and loved ones live healthier and happier and productive lives. Our last webinar, we discussed the effects of inflammation, food, and stress on the immune system. If you were unable to attend the webinar, you can go to the video library on our website, www.theholistichealing.org. You can subscribe to the YouTube channel to view all of our previous functional webinars and all of our upcoming webinars. Also, take a chance to subscribe so that way you're able to receive health blogs from Dr. Ali and the latest research in the field of functional medicine. Today, we ask that you please remain on mute and that you type any questions that you have that arise during this webinar, that you type them in the question and answer section or in the chat area. We will try and answer as many questions as possible during this session. So I'd like to start off with introducing Dr. Nadia Ali. She is the founder of functional integrative medicine practice, Functional Holistic Healing. She's been practicing for 16 years, board certified in internal medicine specialty, board certified in integrative medicine specialty. She's a fellow of the American College of Physicians, a member of the Institute of Functional Medicine, and has certifications in many other areas. You can check out her other areas of certifications and more about the practice at www.theholistichealing.org. So I'd like to start this discussion by asking you, Dr. Ali, what is the importance of leaky gut?
So basically, I think this is a very important question. When we were looking into what should be our topic of discussion, we could have chosen a particular set of diseases like autoimmune diseases. We could have chosen neurological diseases. But we decided to go with leaky gut because when you talk about a specific disease, whether it be autoimmune disease or fibromyalgia or chronic fatigue, a disease is simply a group of symptoms. When they come together and a patient experiences them, we say that you have this particular disease. But the disease does not tell us about the root cause or why does the patient have that problem. But when we talk about leaky gut is a root cause of a lot of chronic diseases. And leaky gut can manifest itself in many ways. So clearly when somebody has leaky gut, we know that they may have gut issues, whether it be irritable bowel syndrome, inflammatory bowel disease. But that is not all, because leaky gut can also cause fatty liver. Leaky gut can also cause obesity. If you look at leaky gut also manifests itself as brain-related issues or neurological issues, mood issues like anxiety, depression, Parkinson's disease, Alzheimer's disease, ADHD, so on and so forth. Similarly, we also find that leaky gut is one of the key factors underlying autoimmune diseases, whether it be a thyroid disease, type 1 diabetes, asthma, multiple sclerosis, rheumatoid arthritis. Leaky gut also underlies diseases such as chronic fatigue, chronic pain, fibromyalgia, cancer, multiple chemical sensitivity. A lot of times when somebody has skin conditions like acne, rosacea, psoriasis, eczema, we think the problem is with the skin, but that's not true. It's something which is going on in the gut which manifests itself as a skin condition. Similarly, women who have hormonal issues like PCOS, polycystic ovary disease, or endometriosis or fibroids, these conditions actually can stem from leaky gut. And that is why we chose leaky gut as a topic, because it is more important to know the root cause of the problem, because then you can reverse a problem rather than talking about a disease, because a disease is simply a list of symptoms. So that was the reason why we chose leaky gut as our topic.
Could you discuss the critical role that gut bacteria plays in leaky gut?
So if we look at the gut bacteria that are within us and on us, it would surprise a lot of us to know that the gut bacteria that we harbor is over 100 trillion. There are more than 1,000 species. And the number of genes of bacteria that we carry is way more than the human genes that we carry. So every gene that we have of our own, we have 360 genes from the bacteria. So technically we are more bacteria than humans because we have more bacterial genes than human genes. All of these small little creatures that we have on us and inside us is called microbiome. And they're absolutely crucial for us because we have a relationship with them, which we call symbiotic relationship, which means that we give them something and in return, we expect them to give us what we need. In other words, we are not capable of fulfilling all our needs, and we need bacteria for us to be able to do what we need to do. So if you look at the entire human microbiome, it constitutes 1 to 3% of our body's mass and can weigh between 2 and 6 pounds. They're located everywhere. They're on our skin, they're in the ears, nose, mouth, very importantly, in a respiratory tract, nose, sinuses, trachea, they're inside the urinary tract, they're also in the vaginal tract. But most of the bacteria is located inside the gut or the digestive system. And hence, the gut is the center of where most of the activities happen. So if we look at the microbiome, what we see is that microbiome is not just bacteria. There's also viruses. There is also fungi. There are also parasites. And not all viruses are bad, and not all parasites are bad, and not all fungus is bad. All of these actually come together. They live together within us, on us, and they collaborate with each other, and they collaborate with us to perform all the functions that we need. So they are as important for our survival as we are for their survival. If we look at the functions that these bacteria perform in our body, the most important function that we find these bacteria performing is, sorry about that, they protect us. They protect us from outside pathogens, which means bad bacteria. When there is a bad bacteria or a bad fungus like Candida that tries to come inside our body, the first line of defense that we have are our existing bacteria, because these bacteria will fight with that new bacteria that's trying to come inside, that's trying to attack us. So they are actually our defense, our first defense. The second thing which is very important to know is the bacteria actually make vitamins. So we have them making B12 for us, they make vitamin K2 for us, they actually make amino acids as well for us. Number 3, they are extremely important for the development of the immune system. And this is the part which we have to understand, because this is where autoimmunity comes into play. Our immune system is made up of immune cells, and the immune cells and the bacteria actually are constantly talking to each other. They are communicating with each other. They're sending signals to each other. And these signals are critically important for the immune system to stay calm, to stay stable. The next important function is the function of angiogenesis, or making of the blood vessels. So remember that the blood vessels that we have in a digestive tract are extremely important, because it is through these blood vessels that we digest and absorb food and take it to the rest of the body. And that is the critical part that is determined by our bacteria. The bacteria make sure that we have adequate blood supply to the digestive tract. The next important function that they play is in terms of fat storage. So when we talk about obesity, the role of bacteria is very important. When we talk about being underweight, the role of bacteria is very important, because the bacteria determine what is going to happen with the fat that enters our body, whether it be stored or will it not be stored. And so they play a very important role in fat storage. The next thing that is really important is production of certain substances that we call SCFA. SCFA stands for short chain fatty acids. These are very, very important substances that the bacteria make. And the goal of these substances is that these substances control a number of functions, and one of the most important functions is reduction in inflammation. They're anti-inflammatory in nature. And remember that most chronic diseases are inflammatory in nature. So we need anti-inflammatory support, which comes from the bacteria. And last but not least, they play a very important role in the brain function and also the function of our nervous system, because there is a direct communication between the brain and the bacteria. And we will talk more about this. But imbalanced bacteria can lead to absolute chaos in terms of performance of brain function and the nervous system function. And we will talk more about it as we go on.
So clearly these bacteria are very important in keeping us healthy. How do these bacteria enter our digestive tract?
So the way they actually come in contact with us, the first and most important process is the birthing process. As the baby comes out through the birth canal, remember that the mother's vagina has bacteria. And during the last trimester or the third trimester of pregnancy, the bacteria in the vaginal tract of the mother changes. And when the baby is coming out of the birth canal, the baby is going to swallow some of the mother's bacteria as it's coming out. And that is the key, because that gives the baby its first bacteria. Similarly, as the baby is coming out, it gets in touch with the mother's bacteria through the skin. That is another way it gets bacteria. We also know that when a baby breastfeeds, then the milk, the breast milk, plays a very important role in nourishment, growth, and maturation of these bacteria. And there are many times when this process can get disrupted. For example, if a mother is exposed to antibiotics during her pregnancy, she may lose her bacteria and may not be able to transfer adequate amount of bacteria to the baby. If a mother receives antibiotics when she is nursing, obviously those antibiotics can go to the baby and actually kill the bacteria that the baby has. Also, babies who undergo C-section and are not born normally, they are born in a sterile environment, which means that those babies never get the bacteria from the mother that they're supposed to get. So all of those factors will affect the type of bacteria, the amount of bacteria that the baby will get. We also know that babies who have been exposed to antibiotics in the first 2 years of life will actually have issues with obesity in later childhood, because those antibiotics will disrupt the baby's bacteria. The bacteria actually grow in number, they actually mature as the baby grows, and by the time we are 3 years of age, we have the full repertoire of bacteria. But a lot of it is influenced by the environment. So we now know that children who grow in rural villages in Africa have a much higher diversity of bacteria than children in the United States, because your surrounding actually determines the diversity of the bacteria that you have. So all of those factors actually contribute towards the human microbiome or the human bacterial, fungal, viral, parasitic load.
So what is the relationship between gut bacteria and leaky gut?
So in order for us to understand exactly what happens in leaky gut, we will have to understand what is the role of the bacteria in the immune system of the gut. So basically what happens, as I have said before, the first and most important function of the bacteria is to protect us. Because when you have a foreign bacteria coming inside, a bad bacteria or a fungus comes in or a virus comes in, a parasite comes in, the first line of defense is our bacteria, our fungi, and our viruses and parasites, which will stop that bacteria and will not allow it to stay inside the body. The second important defense mechanism is that, and we alluded to this before a little bit, that there are constant signals going on between the bacteria and the immune cells that are just outside the intestine. And remember that most of our immune system is actually right in the gut. So we have a lot of immune cells in the gut, and they constantly talk to the bacteria. And when you have a balanced bacteria, then that signal is constant, it's steady, it keeps the immune cells calm. The moment that is disrupted, the moment the good bacteria are replaced by bad bacteria, you will find the person will have allergies, they will have food sensitivities, because what is going to happen is either the immune system will become hyper, which means that it's throwing antibodies right, left, and center. It's activated more than it's supposed to be, or it will go underactive, which means that it will not attack what it's supposed to attack, in which case you will find that the person has chronic infections. Infections like a lot of women would say, I have recurrent yeast infection, I have recurrent urinary tract infection, or you'll find somebody will say, oh, I had Lyme, I had chronic Lyme. Well, the problem was that your immune system is not functioning. And so that bacteria or virus that comes inside your body can do whatever it needs to do without having anything oppose it. And the third line, and very important line of defense, is that the good bacteria actually produce mucus. And the same thing like we have in the nose, that mucus is also present throughout the digestive tract. And that mucus forms a barrier right on the intestinal wall, and that protects it from anything outside trying to get into the intestinal wall or the intestinal lining. When we say that somebody has leaky gut, what we mean is that, you see, this is the normal gut. If you see, this is what we call the security walls. So let's go back. So this security wall prevents anything from entering the bloodstream. And in the normal intestine, we have these security walls which are there, and we have bacteria which form a nice and thick mucus layer right here. And so you are very well protected. When somebody has leaky gut, this is what happens. You can see that there is no security wall. So everything, bad bacteria, fungi, viruses, parasites, actually can enter the bloodstream very easily without any issues. Not only are there the viruses or bacteria entering or bacterial toxins entering, there is undigested food entering the system. And what has happened is, because of all of this activity, all of this extra stuff entering, the immune cells have become activated. And because of that, there is a lot of inflammation going on. So this is precisely what happens when somebody has leaky gut. So when someone has leaky gut, the consequences of leaky gut are the following. The first thing you will see is that there is going to be a lot of inflammation, as we talked about. The second thing is that there is activation of the immune system, meaning that it's throwing out a lot of antibodies. The third thing you will see is that there is an increase in cortisol. Cortisol is the hormone of inflammation. And that hormone actually suppresses the immune system. That hormone increases blood pressure, increases blood sugar, and can cause a lot of damage, particularly if it is elevated for a very long period of time. You will also find that there is abnormal production of neurotransmitters. So what are neurotransmitters? Neurotransmitters are chemical messengers. They're messengers which are used by the brain. They're used by the nervous system to talk to each other. When you produce abnormal neurotransmitters, there will be abnormal connection in the brain, abnormal connection in the nervous system, and then you will basically get a lot of symptoms because of that abnormal communication. You find that in these individuals, digestion and absorption of food is impaired. You cannot get your nutrients, and the result is there are lots of nutritional deficiencies, and hence you'll hear people who have chronic fatigue. You have people who have fibromyalgia. And the reason is that they don't have adequate nutrients because they have an underlying leaky gut. So all of those are consequences of leaky gut.
So how does leaky gut cause autoimmune diseases?
So if you look at autoimmune diseases, there are three pillars of autoimmune diseases. The first pillar is genetics. So 30% of the people who have autoimmune disease will say that they have a family history of autoimmune disease. But just because you have a family history, it is not necessary that you will get an autoimmune disease. Because genetics simply means, or having genes simply means that you have a loaded gun. Just because you have a loaded gun, it does not mean that the gun is going to fire. Even if you have the genes, you will still need some trigger to allow the firing of the gun. But in 70% of the cases, there is no history. There is no family history of having any autoimmune diseases, which means that you can have an autoimmune disease without having a family history of it. 70% of the time, what happens in case of autoimmune diseases is that there is an environmental factor which acts as a trigger. And what that does is that trigger actually causes leaky gut. So the question really is, how does that environmental trigger cause leaky gut? So one of the most important things that an environmental trigger can do is to change the gut bacteria. So this is precisely what happens. So if you have leaky gut, so there was an environmental trigger that came, changed the gut bacteria, and you have leaky gut. So once you have leaky gut, there is the most important thing that's going to happen, which we have talked about before, is that undigested food is coming inside the body. We also said toxins are coming inside the body, which are again proteins. And when they come, they do two things. The first thing they do is they cause inflammation. And the second thing that they do is they activate the immune system. The result of immune activation or immune system activation is production of antibodies. And you need both inflammation and immune activation for production of autoimmune diseases. The third factor that is also very important is that leaky gut is one of the factors which leads to obesity. And obesity is the third pathway through which leaky gut can lead to autoimmune diseases.
So you mentioned obesity as a result of leaky gut. How does leaky gut lead to obesity?
So one of the things that we often see in our patients is that we have women who would come and who would say, I've tried 100 diets. I work out every day, but I can't lose weight. And I have seen so many physicians and I've tried so many different ways, but I cannot lose weight. Unfortunately, in the conventional world of medicine, obesity is all about, how much calories you take in and how much calories you burn. But that is not how it works. There are many, many, many variables which lead to weight gain. And one of the most important variables is leaky gut. When we talk about obesity, we often think that obesity is a risk factor for heart disease. We think obesity is a risk factor for diabetes. But obesity actually is a risk factor for many other diseases, which includes autoimmune disease. It is also a risk factor for dementia. It's also a risk factor for cancer. And so obesity is one of the very important variables that needs to be controlled early on because it can have adverse consequences later on. So we have research which shows that obesity is connected to a number of autoimmune diseases, such as thyroid disease, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, lupus, inflammatory bowel disease, and psoriasis. We also know very well that the gut bacteria between an obese individual and a lean individual is very different. We also know, and we have talked about this before, that babies that are born by C-section have a 64% higher chance of being obese than their siblings born vaginally. We also know that when we use antibiotics, whether antibiotics are used in children or antibiotics are used in adults, all of those contribute to increase in weight gain, depicting that the gut bacteria play a very important role in causing obesity. Here is a very interesting experiment. So if you see these mice here, it's written germ-free. These are special type of mice that have been created in a lab. So basically, these mice have no bacteria either on them or inside them. So they took these mice and they did something very interesting. They did what we call fecal transplant. A fecal transplant is simply that you take the stool from one animal and you put it in another animal. So what they did was they took the poop of a mouse who was very heavy or obese and put that in a mouse that was germ-free or that did not have any bacteria. And what they found was very interesting. They found that that germ-free mouse became obese. When they took the poop or the stool of a lean mouse and put it inside the germ-free mouse, suddenly this mouse became underweight. And when they took the stool from a normal weight mouse and transferred it to a germ-free mouse, that mouse remained normal weight, indicating that the bacteria play a very important role in causing obesity and also in causing underweight situation. So what is the connection between obesity, leaky gut, and gut bacteria? So there are three ways in which gut bacteria can actually cause obesity. The first pathway is chronic inflammation. So if you remember, in the leaky gut, we know that gut bacteria can release toxins, and one of the most important toxins that you will often hear of is LPS. That toxins enters the bloodstream and it causes inflammation. And that inflammation leads to obesity or weight gain. The second pathway through which the gut bacteria cause obesity is what is affecting satiety. What is satiety? Satiety is feeling of fullness. So what you find is that the bacteria can control when we feel full. So you have one individual who has one plate of food and feels full. And there is another individual who needs 5 plates of food to feel full. So the bacteria can actually control when you feel full, and that automatically affects obesity. The bacteria can also cause what is called food cravings. And so they can actually control what type of foods you will crave, and hence will change obesity or cause obesity. Because if you crave foods which is fatty, or you crave foods which is high in sugars, obviously you are going to go into the obese category. The third pathway through which the gut bacteria cause obesity is by changing how we process fats. So when we eat fat, whether that fat gets stored or not is controlled by the bacteria. And there is a third way in which the bacteria actually can cause obesity.
Is obesity the link between leaky gut and diabetes as well as heart disease?
So it is true that obesity is one of the ways you can say leaky gut can cause increased risk of heart disease and diabetes, but that is not the only pathway, because leaky gut allows bacterial toxins to enter the body, and those bacterial toxins can also cause inflammation and increase the risk of heart disease and diabetes. Also, the bacterial toxins can directly cause insulin resistance, which can lead to diabetes. So there are multiple pathways through which leaky gut and gut bacteria can cause increased risk of heart disease and diabetes.
Okay, let's get into the role of leaky gut in mood and neurological diseases. What is the connection between the gut and the brain?
So the gut has actually been called the second brain, and there is a very good reason why that's the case. So we all know that most of the nerve cells, or neurons as we call them, are present in the brain. But what we also know is that the second largest group of nerve cells or neurons is found in the gut. And the gut contains 100 million neurons, which is way more than all the neurons in the rest of the body except for the brain. The other reason why we call it the second brain is that just like our primary brain, this brain is independent. It can function independently of our brain. The third reason is that this brain, the second brain or the gut brain, makes the same neurotransmitters. Remember we said neurotransmitters are chemical messengers which are used for the nerve cells to talk to each other. So the gut brain and the actual brain, they form a lot of the same neurotransmitters. And that is why they can actually communicate with each other. And the connection between the brain and the gut brain is actually through a nerve called the vagus nerve. And it is the vagus nerve through which the bacteria can influence the gut brain and then send signals to the actual brain. So if you look at this diagram, it's very clear that if you have good bacteria and you have no leaky gut, then you will find that the person will have a stable mood, will have no issues with memory, will have no issues with focusing or concentration. However, if a person has leaky gut or bad bacteria, the communication between the bad bacteria and the brain will change the mood of the person. The person will be more irritable, they will be more anxious, they will be more stressed out, they may have issues with focusing, they may have something called brain fog, they may actually have neurological diseases because of the inability of the nerve cells to function. So if we look at mood disorders, one of the interesting and actually sad facts that we now know of was a study in 2014 revealed that the use of a very important class of medications, which we call SSRIs. This is a class of medications which is used to treat depression and anxiety. The use of these medications had increased 65%. And 1 in 8 Americans is actually using these medications. They also found that women were 2 times more likely to use these medications than men. And they found that 1/4 of the people who use these medications have been using them for over 10 years. Why is this important? This is important because these medications, or SSRIs, have been found to cause dementia in the long run. They cause diabetes, they cause weight gain, they cause violent behavior, they cause suicidal ideation, and they have a very physically addictive potential. Now, the interesting part is the way these medications work is that they increase serotonin in the body. And that is how they help with depression and anxiety. But you have to understand this, that 90% of serotonin in the body is produced in the gut. So why is it a surprise that if you have a gut problem, you have depression and you have anxiety? So why is it that instead of fixing the gut, we take an SSRI and put ourselves through more issues? The second neurotransmitter, which is very important in this regard, is GABA. GABA is what we call the calming neurotransmitter. It's the messenger which causes calm in the system. And we know that gut bacteria can directly affect the production of GABA. And so we know that both serotonin and GABA play a very important role in depression, anxiety, and ADHD. If we look at neurological disorders, we find that people who suffer from Parkinson's disease, Alzheimer's disease, and other neurological disorders like multiple sclerosis have leaky gut as an underlying root cause. Conventional medicine does not offer a whole lot when it comes to dementia, when it comes to Parkinson's disease, when it comes to multiple sclerosis. We either have very limited number of medications, and the ones that we have can simply control symptoms. And they can only control symptoms when the symptoms are mild or moderate. But they cannot halt the progression of the disease. They cannot reverse the disease. And the reason is that the medications are supposed to work on the symptoms and not the root cause. But if leaky gut is the root cause, and if you affect that, then you can not only halt the progression of the disease, but you can also reverse the disease. So the question is that how does leaky gut, or how do bacterial imbalance, which is causing leaky gut, affect the brain function? So there are 4 mechanisms by which this connection happens. The first and foremost thing is to understand that there is something called blood-brain barrier. Blood-brain barrier is actually a lining. That lining actually is protective lining for the brain. That lining prevents all of the what we call inflammatory molecules, drugs, and other what we call toxic stuff from entering the brain. When someone has leaky gut or imbalanced gut bacteria, those imbalanced bacteria cause inflammation. That inflammation actually makes little holes in that blood-brain barrier, which means that the protective lining for the brain is completely gone, which means that bacterial toxins that are entering from the leaky gut, fungal toxins that are entering from the leaky gut, can actually enter the brain, and they can actually cause inflammation of the brain. And remember that the brain has what we call immune cells. So when the inflammation starts happening in the brain, the immune cells become activated. And then these activated immune cells actually start causing problems for the brain cells. they actually disrupt the maturation of brain cells, which means that if we cannot have the brain cells mature enough, then they cannot perform their function. The second thing that happens is that good gut bacteria actually produce growth factors, which help generate new brain cells. But when you have bad bacteria, that generation of growth factors is halted. So now we can no longer make new brain cells. So those are all the mechanisms by which gut bacteria, leaky gut, can cause neurological disorders.
Have you seen patients that actually have mental disorders or autoimmune disorders like general anxiety or thyroid disease that are linked to leaky gut, but the patient is not aware that leaky gut is going on in their body?
You know, this is such a good question. This happens all the time. What happens is the patient starts with one chronic disease. For example, they would have an autoimmune disease like thyroid. And they would go to the physician or endocrinologist and they would be given a pill. Now, not realizing that that pill, like when we take medications, medications also disrupt the gut bacteria. So now there was already a disruption which had caused an autoimmune disease. Now you disrupt it even more. And now you're going to get into trouble with another problem. So in a few years' time, you can actually have another autoimmune disease. And now you're going to get treatment for that. This time it will be steroid. Then you disrupt the leaky gut again, and then you get another problem. And so people start with one medication and they end up with 15 medications because the disease either progresses or you get in trouble with other diseases, which are manifestation of the underlying problem, which is leaky gut. But what we did was we did not address the root cause, we only addressed the symptoms. And a lot of times when people come, they are already in a vicious circle and they're beginning to realize that they're in a vicious circle. So they're like, you know, I have tried my best for 3, 4, 5 years and it seems like I'm just getting more and more medications. I really need to stop somewhere. And the point when they realize that there is a root cause is the point where they can actually break this cycle. But this is a phenomenon that happens all the time.
What are the symptoms of leaky gut so we can watch out for them?
So it's very interesting that when we talk about the symptoms of leaky gut, they're not very uncommon symptoms. So we find people who will complain of irritable bowel syndrome, constipation, diarrhea, and a lot of times they don't even realize it's a problem. I had a patient who used to go to the bathroom like twice a week, and he did not think it was a problem. He thought it was normal. He always went 3 times a week. A lot of patients don't even look at their stool. They don't know what the poop looks like. They don't know, what the color is. They never think about it. And that is a problem because a lot of times you think you don't have a problem because you don't even know what you're supposed to look for. You don't know what is normal. So you find people with nausea, reflux, abdominal pain, gas, bloating, gurgling, undigested food in stool, mucus in stool, belching, bad breath, body odor, food cravings, fatigue, chronic pain, unexplained weight gain or weight loss are all the symptoms of leaky gut.
We've established that leaky gut is a very important cause of multiple chronic diseases, such as autoimmune diseases, diabetes, obesity, heart disease, mood disorders, and neurological disorders. So, what are some of these causes of leaky gut?
So the causes of leaky gut are many, and not all causes of leaky gut are inside the gut. So there are certain causes of leaky gut which are inside the gut. For example, if you have poor dietary choices, or if you have issues with food sensitivity, that's inside the gut, or if you have an infection inside the gut. But you can have an infection outside the gut that can also cause leaky gut. For example, somebody has Lyme disease, somebody has mold. Both of those can cause leaky gut. Stress. Presence of stress or trauma can also cause leaky gut. Inflammation can be caused by leaky gut, and inflammation can also cause leaky gut, and inflammation that's generated outside the gut. For example, if somebody has an infection that becomes septic, that can also cause leaky gut. Systemic diseases can also cause leaky gut. Impaired digestion can cause leaky gut. Toxins are a very important cause of leaky gut, and it's unfortunate, but we are surrounded by toxins. A lot of us don't even know that we are being exposed to toxins. Nutritional deficiencies can cause leaky gut, but leaky gut can also cause nutritional deficiencies. Medications definitely can cause leaky gut. And of course, if you are in a situation where you have multiple factors, which happens in most cases, and most people, it's not one reason. It's multiple reasons that have come together over the course of years to cause leaky gut.
So, the number one question, can leaky gut be reversed?
Yes, this is definitely a very important question. And I have to tell you that a lot of my patients have actually surprised me. I have some patients who are actually in their 60s. And when I first looked at their leaky gut test result, I was like, oh my God, this is such a huge degree of leakage that's going on. And I was wondering, you know, how long will it take me to reverse this? And they surprised me. They surprised me because within a matter of few months, we found them to have, you know, significant progress in terms of what they could eat and what they could tolerate and how their symptoms reversed. So one of the things I have learned is that the body is very powerful. It actually is trying itself to get into a state of balance. It has tremendous healing capacity. And there's no reason why we cannot reverse leaky gut. But the key is to understand what is the root cause. You know, a lot of times, one of the questions I get all the time is, give me a protocol for how to repair leaky gut. You know, tell me what is it that we can do to reverse leaky gut. And I always have to tell people that it is not about a protocol, because a protocol means that everybody has the same reason for leaky gut. And that is not true. Everybody will have their own set of root causes, which is all about their own history, what they encountered in their life. And so the key is to find whatever the single root cause or multiple root causes that you have, and then to actually take care of that root cause. The other thing is there are certain things which have to be optimal before you will be able to make sure that you repair your leaky gut. For example, your hormonal system has to be balanced. Your nutritional status has to be optimal for you to be able to repair the gut lining. The microbiome or bacteria needs to be balanced. Your immune system has to be stabilized and calmed down. And last but not least, reduction of the toxic burden. Very important. Without making sure that the internal milieu or the internal environment of the body is optimal, you will not be able to repair the leaky gut. And so all of those things need to be taken into account.
Thank you so much, Dr. Ali. And at this time, I'd like to introduce our next webinar, which will be Mercury, the Cause of Chronic Disease, and our guest panelist, Dr. Mary Jo Mazzaro. The date will be July 11th at 4 p.m. She is a biological dentist, and we do ask that you register as seats are limited. So, and the objectives of this will be: what is the link between mercury and autoimmune disease? How does mercury lead to neurological disorders such as Parkinson's disease and autism? What is the role of mercury in causing obesity and fatty liver disease? And what are the symptoms of mercury exposure? and what are the sources of mercury, how to reduce the burden of mercury in the body. So I'd like to take this time to answer questions that we have received. So I'm going to go ahead and stop my video so that way I can look at the questions. So number one, can we test for leaky gut if we have a suspicion that we have it?
Definitely. We actually have multiple ways to check for leaky gut. And not only can we look at leaky gut, we can also look at the degree of severity there is. What we use is we use antibodies for detection of leaky gut, which helps us understand what is the degree of leakage and what's the extent of the problem. So yes, definitely there are ways to look for leaky gut.
I went to my doctor, and why are some physicians not aware of leaky gut?
So one of the things you have to understand is leaky gut is a layman term. The scientific term of leaky gut is intestinal permeability. And it's a concept which has developed in the last 5 to 10 years. And it takes 10, 15, 20 years for bench research to get into clinical practice. So that is why most physicians are not aware of what is intestinal permeability or leaky gut, and they are not trained to treat leaky gut. However, if you go to a functional physician, most functional physicians are aware of what is leaky gut and will be able to help you out.
Can someone have a leaky gut and not have any of the digestive symptoms?
Yes, I think like I said before, a lot of times there are symptoms that are present, but the individual is not aware of them. And there are times when there will be no symptoms, no digestive symptoms per se. And this happens actually very frequently when a lot of time people have celiac disease. And the first manifestation is that they have a skin rash, which they are surprised to see. They go to a dermatologist, and the dermatologist looks at the rash and realizes it's celiac. And so he or she will direct the patient to gastroenterologist, who will do an endoscopy, will go down, put a tube in, take a biopsy, and then tell the patient you have celiac disease, you are sensitive to gluten. And so definitely it's possible that you may not have gut symptoms, but you may have leaky gut, definitely.
I have an autoimmune disease, and I've been told my body is attacking itself. Is it possible to get better?
Definitely. I think you have to understand that, like we said, that when you have a leaky gut, you have an immune system which is very, very activated. And that is why it's producing antibodies. When the immune system is going to calm down, it would not produce as many antibodies. It will not have as much of an inflammation. And when you're able to do that, then automatically you will find that your disease will not only stop, it will start to get reversed, because antibody production will no longer happen, because the root cause of why it was happening has been taken care of.
Once the immune system is interrupted, is that lifelong?
No, I think that, remember that immune system is a system which changes over time. Everything in the body is dynamic. Just if something can happen, then we can also reverse it. So it's an acquired process. We were not born with antibodies at birth. We acquired antibodies. So if we can produce something, we can stop the production of that as well.
So that actually leads right into another question that we got, was what can we do to help our baby's microbiome who were born via C-section?
So what we do usually is that there is a way to go about it. There are certain probiotics that we give for babies, and we tell them exactly what quantity we want to give the baby, because remember that the microbiome of the baby is different than the microbiome of an adult. So you cannot give the same probiotics you give to adults to babies. So you have to be careful in terms of what probiotics you're giving to the babies and what quantity you are giving, because when you are dosing babies, you have to dose them by their weight, and you also have to dose them by their age. So yes, we can do that. And we have a number of patients, who have gotten babies, and it's really nice because I think 2 or 3 just had babies in the last few weeks. It's a nice feeling to be able to have results with your patients that are so positive. And one of my patients actually had C-section very recently, and we kind of gave her the probiotics and other support that we wanted the baby to have right away because of that, to make sure that the microbiome develops normally.
Okay. What tests would be used to determine if a teenage boy has leaky gut, or in other words, how do you rule out ADHD by investigating if it's leaky gut before any meds? What herbs, supplements could be tried first to look for improvement in mood, anxiety, energy? And then there was a few things like ashwagandha, rhodiola, or any others. Thanks.
So I think the important part, I think, that I would tell you is that when we are looking at a functional approach, we don't necessarily just say, okay, you know what, there's an ADHD, let's throw this supplement, let's throw that supplement at the patient. No. Supplements, if you're going to use supplements in place of medications, you're doing exactly what the conventional medicine does. You are still trying to substitute a medication for a supplement to suppress the symptoms. The first thing is to be able to know, why does this individual have leaky gut? And then depending on the cause of the leaky gut, you decide, okay, the root cause is either because there's cortisol elevation or there's nutritional deficiency. You address the specific cause of the leaky gut. Do not throw just what you call supplements or herbs at the patient. Think about it. Think about the root cause first. Identify the root cause first. Then you can go ahead and decide what you want to give to the patient depending on what you have found.
So does mold or Lyme trigger leaky gut? Or does leaky gut happen first, which then triggers mold or Lyme inflammation and the ketone storm?
That's a very good question. Both mold and Lyme can cause leaky gut, and leaky gut can cause chronic Lyme and mold issue exacerbation. So why is that? If you have mold and Lyme, they cause significant degree of inflammation, which can cause leaky gut. If you have leaky gut, like I've said, you can have an immune system which does not respond appropriately. So, you know, when I had Lyme disease, which I diagnosed myself because I had very atypical symptoms, and I took a 10-day course, and it went away right without a problem. But there are people who are sitting with chronic Lyme for months and months and months. So what is the problem? The problem is the immune system, which is not working to get rid of the Lyme. So if you have a leaky gut, you will be somebody who will have chronic Lyme, or who will have what we call mononucleosis or EBV reactivation. Also, when you have mold toxins, if you're exposed to mold and you have a leaky gut, your ability to get rid of the toxins is significantly reduced. So obviously your mold issue will get exacerbated because of the inability to get rid of the problem. So it can go both ways.
Okay. Can leaky gut cause food sensitivity? And is there a way to prevent food sensitivities with a permeable gut?
Definitely food sensitivities are a result of leaky gut, and there's a way to do food sensitivity testing to know what food you're sensitive to. But in people who have significant leaky gut, we do not do food sensitivity as the first test, because a lot of times a lot of things will be positive. And so how many things will you take the patient off of? So when we are looking at the patient, when we are treating the gut, there is a point in time where we have stabilized the system enough that at that point in time, we say, okay, now we're going to go ahead and do the food sensitivity test and tell the patient what they need to stop, how frequently do they need to stop, how they can re-enter the food again. Because remember that you don't necessarily want to eliminate too many foods, because if you eliminate too many good foods, then you're also kind of affecting the nutrition status of that person. And you don't want to do that, because that itself can be a hindrance to the healing of the leaky gut. So you have to be very careful when you order these tests, and how do you work on these tests, how do you interpret these tests, particularly for long term.
Is leaky gut the root cause of all major diseases?
Leaky gut has been found to be one of the root causes of a lot of chronic diseases. There's no question about it. But to say that that's the only cause, I think that would be a mistake. Because we also know that there are toxins that I was telling you guys about, that we are exposed to a lot of toxins. And a lot of these toxins actually can create a havoc on the system. And they may not necessarily enter through the gut, although they can enter through the gut, but they may not necessarily enter through the gut. For example, we were talking about mercury, like, we talked about our next session that we are doing on mercury. A lot of us have silver fillings or have had silver fillings, and silver fillings do have mercury in them. So that could actually trigger a lot of inflammation, and that can cause leaky gut as well. So yes, leaky gut is a root cause of a lot of issues, but we also have to know that there are other variables which also have to be taken into account. Because those are important variables, like mold. Like if you're exposed to mold, you can get leaky gut. But if mold is the cause of leaky gut, then you have to fix the mold issue. Because if you fix the mold issue, then the leaky gut can be repaired, right? So you really have to understand, and unfortunately, it's not as simple, like how we would like to have linear associations. But most of these associations are bidirectional. And so it's almost like an onion with a lot of layers, and you have to figure out which layer do you want to peel first, and how one layer is affecting the other layer. So it appears simple, but it is quite complicated when it comes to application to each individual. And that is why we often talk about customization or personalization of a protocol. Because one person, leaky gut may be from mold, and the other person, it may be because of Lyme, and the third person, it may be because of mercury toxicity. And we have to be able to tease that out.
So can leaky gut induce obesity to be linked with compulsive eating and food addiction?
Very good question. So
I think can it be linked? So can leaky gut cause obesity and linked to compulsive overeating and food addiction? So are they linked?
Are they linked? Okay, so basically leaky gut, we know, is because of bacterial imbalance, and we know that both leaky gut and bacterial imbalance can cause obesity. We also know that food addictions and food cravings can be a result of gut bacteria as well. There's no question about it. And that they're definitely linked. But remember that food addictions can also be a result of what's going on in terms of trauma in your life. It can also be connected with stress. So when you are talking to a patient, you might find that one problem that you have identified is being affected by multiple variables. And what you need to do is you need to understand, how do you piece it out? How do you understand what is the most potent factor which is affecting it, and start with that, and then you deal with the second factor and the third factor. And yes, these are connected, but there are many things which kind of go in together. So obesity causes obesity is caused by leaky gut. Food addictions are caused by leaky gut and bad bacteria. Cravings are caused by bad bacteria and leaky gut. But there are other variables which also affect food cravings, other variables which also affect food addiction. And so those variables will also have to be addressed, because if you do not address those variables, then you will never be able to help the patient.
Is Zoloft bad?
My understanding is Zoloft is an SSRI. And as we have said before, that if you are going to manipulate your brain for a very long period of time, you are going to get into negative consequences. And we have talked about We have talked about it causing dementia. We have talked about it causing diabetes. We have talked about it causing violence. It's addictive in nature. It's physically addictive in nature. So there are lots of side effects, weight gain with Zoloft. And the truth is that, there is a reason why you have developed the symptoms that required you to be on Zoloft. So why are we not addressing the issues that cause the symptoms to start off with? Using Zoloft for a short period of time is perfectly okay. Sometimes we're in a very traumatic situation. And sometimes we need to be able to work and have a normal life. And for a short period of time, we may need some help. And we can use the medications to aid us for a short period of time. But I would not recommend using any medication for a long period of time, until and unless it's something like insulin. Like if you don't have insulin and you have diabetes, unfortunately, insulin is the hormone that the body makes itself, and it needs that. SSRI is not something that the body makes itself and needs that. So we really have to be able to distinguish, what we are taking and why we are taking and how it's affecting us and how it's affecting our gut bacteria.
I take SSRIs. I would like to get off them. Is it possible to get off them and still be functional?
It's definitely possible to get off of them and still be functional. I think there are many, many, many tools that can be used to help people who are suffering from depression or anxiety. But like I've said before, the first question is that why did you develop depression? Why did you develop anxiety? What are the root causes that have led to sustenance of this problem? And once you address that, and once you are able to control the symptoms, then once you are in a position to be able to control those symptoms, then it is very easy for us to taper you off of SSRI. But you can't do it in one day. There's a process that you have to undergo to be able to understand, what are the root causes, address the root causes, and then slowly help you taper off the serotonin.
Can/do general practitioners, nurse practitioners, etc., test for leaky gut? Is the condition that is it a condition that traditional doctors embrace or shun?
No, no one does testing for leaky gut in the conventional field. Rather, the tests for leaky gut are not even covered by insurance because they are considered to be research based. And so, no, unfortunately, you won't be able to get much from the conventional side.
I am using birth control. Could you discuss how that may affect my gut?
Birth control or oral contraceptive pills or hormones in any form that we put in our bodies can have a lot of adverse consequences. We know that birth control pills actually increase the risk of inflammatory bowel disease. They increase the risk of autoimmune diseases. They increase the risk of high blood pressure, migraine, clots. So there are a lot of side effects. And so if you are taking oral contraceptive for a particular reason, for example, if you have endometriosis or you have issues with PCOS, then I would suggest that you find out the root cause of it instead of bombarding yourself with hormones, because remember that the hormones that we take, such as the oral contraceptives, they're not even natural hormones. Sometimes they're derived from horses, sometimes they're synthetic in nature. And the hormones that we naturally produce, the body can get rid of it within a matter of days. But the ones that we enter our body that are synthetic or that are not our own, the body may take months to be able to get rid of them, which means that they actually have lingering effects for a very long period of time, which basically is the reason why we see so many adverse consequences with those hormones.
What are your views on fasting in the healing of leaky gut while adding L-glutamine so that way the gut can repair? And do new gut linings cells regenerate after 3 days?
So I think that it's a really interesting question, because we have to understand that when we talk about fasting, Remember that just like any tool, fasting has its pros and cons. And we also, I think, talked about the fact that leaky gut itself can cause nutritional deficiencies and it can cause issues with malabsorption, which means that somebody who has leaky gut and goes on to do fasting, that actually may be a mistake and can actually make things worse. Fasting plays a very important role in helping the repair of the gut. So there is a way we use fasting when we use it in protocols. It's not the first thing that we do in terms of the leaky gut. So there is a way that it has to be used. It has to be used at a particular point in time where we know that that individual, the immune system has calmed down. We know that the person is nutritionally doing very well. At that point in time, we can think about fasting and in what form to use fasting. There are many, many, many forms of fasting. There's intermittent fasting, there is juice fasting, there is 5-day fasting, there is water fasting. And depending on the person and their metabolic activity, you have to decide what type of fasting are you going to use in that individual. As far as use of glutamine is concerned, again, that comes much later when it comes to repair. You have to do a lot before you get to the repair. You know, if there's somebody who's breaking the wall every day and you get somebody and say, I want you to repair the wall, what's the use? There's somebody who breaks down the wall every morning, you build the wall every night. I mean, this is a redundant process. This is not going anywhere. So when we are looking into repair, the first thing is to stop banging on the wall. Please stop breaking the wall. Then you can think about repairing the wall. But if you cannot stop the wall from breaking, then you are just spending a lot of time and energy, which is actually going to go wasted. So we have to look at the process in a manner like, you know, a detective looks at a case. You know, what is the problem? First fix the problem, then you go and repair.
How long does it take to heal leaky gut? Also, how do you know it's healed? Do you need testing, or is it just the absence of symptoms?
So it depends. So, you know, when we do the leaky gut testing, we look at certain antibodies. For example, when we look at anti-LPS antibodies take about 3 months to repair. Then we look at anti-zonulin antibodies. And if you have anti-zonulin antibodies, it takes about 6 months to repair. And if you have anti-actin antibodies, they take about 1 year to repair. So it depends on what type or what extent of damage you had, number one. Number two, on the basis of the type of antibodies, you can predict the amount of time that it will take for you to repair. Yes, we do retesting in people to see if people have actually completed repair or not. But we don't do it right away. We take about a year or 12 months because we want to complete the process of removing the root cause and then repairing it. And then we would do that testing to see if we have patients who would say, look, I feel so much better, I don't have any symptoms, do I really need to get tested? No, if you feel really, really better and you feel like you don't have any issues and you don't want to get tested, that's fine. But we do encourage people to do the repeat testing in 1 year or so, because we want to be able to objectively see. Because like I said, there are a lot of people who may not have symptoms but have leaky gut. So we prefer objective evidence to subjective evidence. But if we have subjective and objective evidence, nothing can be better than that.
What are some of your best food suggestions for healing the gut?
I think this is a really important question, and this question also gets asked a lot. And one of the things I want you to know is one man's poison is another man's medicine. And, you know, I had a patient who came to me and she said, you know, I eat only the best of the best. And the truth was she was a very well-read patient, and she would eat herbs and she would eat like, she knew exactly which berry would have the most nutrients, and she would eat that. And the reason why she came was she was very frustrated. She said to me, Dr. Ali, I don't know, I eat the best of the best. I eat the most organic food, and I don't know why I'm having so many issues with my gut. And the truth was that what she was doing was actually right, except it was not right for her. So the best foods for one person may not be the best foods for the other person. This is one of the reasons why if somebody asks me, so Dr. Ali, should I go on FODMAP or should I do SCD or should I do, you know, a keto diet or paleo? I often tell them, I don't want you to do any of those diets. I want you to do the diet that's for you. That's why when patients come, we make them keep diet diaries. They keep diaries for months and months and months, and it's not easy to keep a diet diary. I can tell you that. It's extremely difficult. But I also have to tell you that it is only with that diary that we can actually design a diet for the patient, which will be the best for the patient. So there is no best diet. The best diet for one person is the worst for the other person. So somebody may do very well with keto, but the other person, it will be a disaster. So there is no food which is the best food, because there will be people who will have an issue with cilantro, and they'll have an issue with berries, and they'll have an issue with X and Y and Z. They'll have issue with almonds. So what I'm trying to tell you is that there is no best food. It is the person that you have to look at. And then you have to determine what is the best diet for this person, this specific person with this specific gut issue, with this specific food sensitivity, so on and so forth.
I'm going to go ahead and combine two questions, but they go really well together, which is, what about probiotics, turmeric, or slippery elm and DGL to help leaky gut? Can they help treat leaky gut?
You mentioned turmeric. Turmeric is an herb. I think I always encourage my patients, and I would encourage everybody, if you want to use a little bit of turmeric in your food, that's great. I would not recommend more than a little bit of turmeric, because it is not very bioavailable, meaning it does not have a lot of absorption capacity, so you can actually have pain. Rather, a lot of people who have raw lining may actually have pain with turmeric, but if you use it in a pinch amount, like when you use it in a curry, you just use a pinch of turmeric, you can definitely use that, it's very good. Slippery elm, DGL, and what was the third thing you said?
I think that was it.
So slippery elm, DGL are substances that can be used to heal the gut. But remember that who needs slippery elm and who needs DGL, all of that needs to be determined.
Sorry, pardon me, it was probiotics.
Probiotics. I am going to touch on probiotics separately, actually. But as far as DGL is concerned, as far as slippery elm is concerned, they can play a very helpful role in certain patients with certain symptoms, but they are not blanketly going to be helpful for everybody. And this is the part which I think is very frustrating for me as a functional physician. We have patients who often bring boxes and boxes of supplements. And when you ask them, they can tell you, like, this bottle helps with 5 things and this bottle is supposed to help with 6 things. But if you ask them, is it helping you? They're like, well, we don't know. So there are tons of supplements that I can name that are very helpful for the gut, but are they helpful in everybody? No. So which supplement is going to help whom is a determination that will be made depending on your symptoms, depending on the data that we get through the testing. And then we can tell you, well, this is what we are using, this is why we are using, and then we should be able to have the patient use it and then have a diary which tells us whether there was a change in outcome or not. Because if there is no change in outcome, there's no point in using that. As far as probiotics are concerned, I think there are a lot of people using a lot of very expensive probiotics. But the problem is that, unfortunately, we have no idea what our microbiome looks like. We don't know what bacteria we need, what bacteria we have, and that is why we may actually be making a futile effort. So we don't, like, as a functional physician, I do not give any probiotics until and unless I make sure that I know what the microbiome looks like. And then I know exactly why I am giving something to this patient. The other thing is there's some people who have very sensitive guts who already have overgrowth of bad bacteria. In that case, when you add probiotics, the patient will actually have a lot of issues just because they use the probiotic. So you have to be very careful when you're dealing with people who have dysbiosis and you're putting in probiotics, because those can actually make the situation worse. And that's why I say that, one man's medicine, other man's poison. So you have to be very careful. You have to understand what you're doing, why you're doing, when you're doing.
So just starting with a CFU probiotic to just start with that to heal leaky gut.
Like I said, this is a question which I've already answered, that it is not about the amount of probiotic that you're going to use. The type will all be dependent on what the situation is.
Is it okay to eat the standard American diet if I have no issues?
No. And the answer is that a standard American diet, it's the definition of you have no issues is something that I would debate on, because a lot of times, when somebody develops a chronic disease like heart attack, they would come and say, oh, you know what, I was perfectly okay till like 2 months ago, and then I had a heart attack. I mean, this statement is actually a problem by itself, because it takes 10 years, 15 years to develop blockages of the arteries. So it wasn't 2 months ago that you had a heart attack. You had a problem 10 years, 15 years down the line, you have been having this problem. So a lot of people don't even know what's going on inside their bodies because they're not used to communicating with their bodies. They're very strong people. They do what they need to do, but they don't have a very good communication with the body. So standard American diet by no means is a diet that's actually suited our genes. Our genes are not supposed to be exposed to that kind of diet. And before you can make the claim that everything is okay, I would want objective evidence of that. And I don't mean the objective evidence to be a CBC and CMP regular blood work from your doctor. I mean actually detailed workup. Like when we do a detailed workup on our patients, we look at a lot of inflammatory markers. We look at a lot of nutritional markers before we say, yes, you are okay. So the term okay needs to be questioned as well. And definitely I would not advocate a standard American diet. That's not what our forefathers had. That's not what genetically is going to suit us.
I'm going to take a few more questions and then we'll go ahead and wrap up. So does elevated cortisol give you a higher blood pressure?
Yes.
And could a ruptured appendix cause or accelerate leaky gut?
A ruptured appendix definitely would be, an appendix will rupture only if it is inflamed. If you remember that the way it happens is the phenomena is that the food actually gets stuck in the appendix. And then what happens is that there is that food particle causes inflammation, there's swelling of the appendix and the opening closes. That's when you have a swollen appendix. So the fact that you have inflammation of the appendix also means there's inflammation of the gut around it as well. So automatically there is leakage at that point in time. I mean, you already have leakage at that point in time when you have a swollen appendix. And of course, if it ruptures, there's no question that now you have inflammation through and through the peritoneum and your abdominal cavity, which will go on to other parts of the intestine as well. So yes, if you have a ruptured appendix, that's a pretty bad sign of inflammation. Inflammation not only of all your intestines, but also inflammation of other organs inside your abdominal cavity.
Does autoimmune activation always lead to autoimmune disorders? What's a roundabout percentage?
I don't have percentages to tell you, what percentage of immune system activation would lead to autoimmune disorders. But remember that there are a lot of people who may not have autoimmune disorders, but would have immune system activation. So we find a lot of people who will come with neurological symptoms, maybe because they have immune system activation. People have neurological diseases, like in the brain, have immune system activation of the brain. So you don't necessarily have to have autoimmune disease as a result of immune system activation. You could have a lot of other symptoms from immune system activation.
And so you talked earlier about the different causes and the things that lead to disease. And for you, what have you seen to be the most typical causes of leaky gut, which would be like toxins, mold, or gluten?
I don't think there's a typical, honestly. I think this is the question of what is the typical. There is nothing typical. In most cases, the only thing I can tell you, in most cases, we don't find a single cause. In most cases, we find 2 or 3 things leading to leaky gut. It's never a single cause. And that's why we identify whatever 2, 3 factors. Oftentimes there's 1 or 2 factors inside the gut, 1 or 2 factors outside the gut, and we identify all of those factors and address all of them. One factor that we consistently see as a problem, probably in our society, is cortisol, no question about it. A lot of people with elevated cortisol. And we live in extremely stressful times.
And since leaky gut is so critical for the overall health, when should we test for gut health as to prevent diseases? And should there be a screening in life earlier in life on a reoccurring basis?
So gut health is definitely critical, and there's no question that our gut health should be tested periodically to make sure that we are doing well. I completely agree that we should have testing much earlier. You know, we see a lot of kids who have allergy issues in this country, a lot of kids with ADHD issues, and nobody has ever kind of asked them the question, what's going on in your gut? You know, do you ever look at your poop? Do you know how many times are you going? Do you have bloating? Do you have gas? So any kid with any kind of issues related to ADHD, issues with allergies, they definitely need gut testing. There is no if and but about it that they need gut testing. And if you're eating a standard American diet, unfortunately, all of the people who go to college, they drink a lot of alcohol and they drink and they eat complete crap. Unfortunately, they will have to be tested. If that's because if we can't change things, at least we can show them what they're doing is kind of doing to their gut and their gut bacteria. No question about it. And definitely testing needs to be done, and it should be repeated. I won't say yearly, but at least in a few years' time to make sure that you're going in the right direction. And so we can also tailor your probiotics according to that.
And our last question, do taking PPIs accelerate leaky gut as a side effect?
No question. PPIs cause a lot of damage. PPIs are directly implicated in small intestinal bacterial overgrowth. They are directly implicated in malnutrition. They are implicated in causing pneumonias, implicated in osteoporosis. The list of side effects with PPIs is very, very, very long. And I would definitely not advocate anybody using PPIs on a long-term basis. It's definitely disastrous.
And there was one last one that popped in, and it's, can you speak to the relationship between leaky gut and severe acne in a teenage boy?
Leaky gut has significant hormonal influence, and leaky gut can cause acne through hormonal imbalance. It can also cause acne through direct food sensitivity. It can also cause acne through significant degree of inflammation. It can also cause acne because it affects cortisol levels. There are many, many, many pathways that connect leaky gut to acne, actually.
Thank you so much, Dr. Ali. And I would like to thank everybody else for joining us. It was a pleasure. And that concludes today's webinar.